Today, we have been witnesses of the plight of a virulent pandemic, namely coronavirus or COVID-19. Each passing day is a battle against the exponential increase of cases as the outbreak takes its toll. Historically, pandemics were neither new to us, and it has been brought paramount importance to our health. That is, we should not take our health for granted. One of these dreadful diseases that silently consumes a considerable portion of our population is the sexually transmitted disease called HIV or human immunodeficiency virus. What is HIV? Human immunodeficiency virus. HIV is a viral infection that progressively destroys certain types of white blood cells. It can cause acquired immunodeficiency syndrome or AIDS. AIDS is the most severe form of HIV. Where did HIV came from? HIV infection in humans came from a type of chimpanzee in Central Africa. The chimpanzee version of the virus, called simian immunodeficiency virus or SIV, was probably passed to humans when humans hunted these chimpanzees for meat and came in contact with their infected blood.
AIDS stands for Acquired Immune Deficiency Syndrome, which means deficient immune system. You get AIDS after becoming infected with the HIV virus. You get infected with the virus by unsafe sex, contact with blood of an infected person, for example by using a contaminated injection needle, from mother to child during pregnancy, childbirth or breastfeeding. Because the virus is transmitted through blood, sperm, vaginal fluids, preseminal fluid, breast milk. You don't have the risk of becoming infected with the virus by saliva or shaking hands. When you have HIV virus but aren't symptomatic yet, you are seropositive. That means that there are HIV antibodies in your blood. You don't need to have any signs of disease yet. An HIV infection passes through 4 stages. In the first stage, the body can show signs of disease like continuous fever and swollen glands, while some people who are infected remain asymptomatic in their first stage. In the second stage, recurring airway infections, skin, mouth, and genital lesions often occur. In the third stage, you may have complaints like prolonged diarrhea, excessive weight loss, tuberculosis in the lungs, and other serious infections like meningitis. Finally, besides serious infections, the nervous system may be affected in the 4th stage, which can result in motor loss or AIDS-related dementia. It may take 5 to 15 years before you know that you've got AIDS. This is because sometimes it takes longer for symptoms to occur. HIV and AIDS can be treated with medication but can't be cured. Antiretrovirals slow down the multiplication of the virus but doesn't kill it. To support the treatment, AIDS patients often get medications to boost the immune system and fight against infections. You can prevent AIDS by having safe sex and using clean needles.